recognize a member from Oshawa.
Thank you very much, Speaker, and I am also glad to be able to stand and make some remarks on behalf of my constituents in Oshawa on what is an immensely important topic, and this is a very involving conversation about strengthening quality and accountability for patients, as this Bill 160 is so beautifully named. Speaker, if only this bill indeed strengthened quality and accountability for patients. You know, I start a lot of my talks in here with the same thing, pointing out how lovely the titles are. But again, this is another bill that is wanting, and you know, coulda, shoulda, woulda. This is a bill that has 10 schedules in it, but it isn't addressing the heart of this, and that is about providing predictable, better hands-on care, strengthening our healthcare system for Ontarians. I called my constituency office yesterday and said, is there anything new that's come in the last couple of days that, you know, I'd like to be able to share in the legislature? And it's the same conversation we always have. It's, you know, folks who might feel that they've been pushed out of hospitals too early. It is cases of still inadequate post-stroke care. That has come up a few times in the last few weeks, despite the changes that have been made. This is one that we have a 71-year-old requiring spinal fusion surgery, if you can imagine, that was diagnosed back in July of 2015, and there's still no date booked for the surgery. Spinal fusion surgery. I don't know exactly what that entails, but I hope I don't ever have to go through that. But the quality of life would be seriously impacted by that condition, and that was just off the top of the head of one of my constituency assistants. I have letters here that I'll be sharing, Speaker, but it comes down to the same. This is a bill that has 10 schedules, that is an omnibus bill, and it doesn't get to the heart of it. It isn't willing, this government isn't willing, again, to do the work to make the changes when it comes to long-term care, when it comes to our hospitals, when it comes to appropriate access to health care services, when it comes to pharmacare. Like I said, coulda, shoulda, woulda. So anyway, we'll help them out with that, though, because we will all be looking forward to committee. And Speaker, at committee, I really hope that this majority government will listen to the folks at committee, that we will hear from the front lines, that we will hear from caregivers, healthcare providers, that they will listen to the patients, because they don't seem to. Because if they did, it would be reflected in this piece of legislation, I think. But also, as we heard earlier, the patient ombudsman or patient ombudsperson, even her office has called for the ability to be independent and to have the kind of oversight that would be required to make a difference. Again, you know, that was, I won't call it a token position, but it could have been what we need in Ontario, which is that independent layer of oversight. So I hope that they listen to her at committee as well, because I know she's been connecting with folks in my community, and I'm sure others. But, you know, for years, Speaker, we have seen this Wynne government, we've seen the Conservatives chipping away at Medicare and letting people down when they need it the most. I saw my Conservative member over there. I think he was giving me a high five. I'm not sure. But if he's wanting me to further clarify, I'm happy to do that. More than 1,600 registered nurse positions have been eliminated inside Ontario hospitals since the start of 2015. And the last time that the Conservatives were in office, Speaker, I'm happy to remind you, they cut 6,000 nurses, closed 28 hospitals, and shut down over 7,000 hospital beds. And Speaker, if we're going to talk about cuts, as you know, my colleagues in the other parties appreciate cuts so much. Cuts aren't just numbers, Speaker. Cuts aren't you know, numbers on a balance sheet. They're people. They're families. When we cut beds, it means that people get treatment, if they get it at all, in the hallways. If we don't have the mental health beds and services, it means that people are in our streets and in our nooks and our crannies, and we know what that looks like in our communities. I was talking to some of our police members of the community, and they They deal with it on a regular basis. When we are not supporting our mental health system, our health system in general, then we are expecting our public services, our police, our partners in the community like John Howard Society to address the issues. So again, we have an omnibus bill here that could have put more focus on these issues, and it doesn't. We need to be seeing minimum standards of care. This is a bill that opens the door to privatization. No, Speaker, that is the wrong direction to go. When we look at our hospital system, and out in Durham, you know, there's lots of talks about mergers and amalgamating and all of that, and we see such pushback from the community because all of these plans happen without doing the math on where the growth is and what the need is. And when you're going to take services out of hospitals, you know, strategically or just kind of let it happen and pull those services out and place them in little specialized, you know, clinics here and there, not only do people not have the access that they need and the health care that they deserve at the hospitals, but then they have the further burden of having to pay for the travel to get from A to B to C to D. You know, up in Peterborough, when my grandmother was living there and having to go from one place to another for different appointments, she was, you know, at 90, I guess then it would have been 94, 95, was fully capable of making the appointments and then had to take a taxi and pay for that herself all across the community to get to her necessary appointments instead of going to one hospital the way that it used to be. And folks who have a hospital near them go there expecting that they have access to services. Oh no, just kidding. You've now got to go maybe to Bowmanville or wherever. And people don't understand that the health care, this building right here that is supposed to be about health care is actually just one point on their health care map, and they're going to have to navigate it all over at a cost to themselves. Hopefully they have the money for transit, because again, here we are planning our health care. I say planning. That was really generous of me. We are creating a healthcare system without doing the planning and looking at where people are living and where the growth is and how they can travel, and it's not keeping up with our bus system and all that. But, Speaker, that's another conversation. I'll move over here for another day. I'd like to talk about long-term care. I have folks in my office on a constant basis with long-term care needs, that they are concerned about their loved ones, their parents, their spouses that are not able to get the care that they deserve. I've had folks who are PSWs and working in our long-term care system in tears in my office saying, I went into this 10, 15, 20 years ago, and because I care, and now I have to let my residents sit in their own waste, waiting for care because there aren't enough staff on the floor to attend to some of it. They're forcing people into incontinence that otherwise could use the facilities with help, but because there might only be 2 people on the floor that have to lift someone down the hall, sorry, you're just going to have to wait. That's just one indignity that happens on a regular basis. I had a woman in my office who put cameras in, who did all sorts of things, was trying to work with the home to make adjustments to accommodate her mother's specific needs, and they just couldn't. They couldn't meet those needs. Her mother has since passed under terrible circumstances, and this is a government that has said over and over that they're not willing to expand the scope of the inquiry into long-term care. We need to look at the whole system and say what is right, what is wrong, what is working, where do we need to invest, where do we need to shift resources. And in fact, actually, Speaker, were you here that day? Well, never mind, maybe you were here that day, but we voted. It was a weird day. You might recall that the opposition parties won the day. There were, well, the NDP won the day, really. There were 3 NDP bills and motions on the table. Am I allowed to say there weren't enough Liberals to form the majority? I don't remember who was and who wasn't here, but they weren't the majority that day. We won. We had those 3 bills and motions passed, and one of them was the motion to expand the scope of the long-term care inquiry, and even some of their members voted for it because it was a free vote. Again, it was a magical day. But then they acted like it didn't happen. Like, oh well, the will of the House, who cares? We're still not expanding it. We're the government. We're the majority. Na 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 na. So it's so frustrating that the people of Ontario want care, want access to care, and this government says, meh, nope. In fact, worse than that, they're putting forward a bill that is potentially doing damage, that it is making it easier for the government to privatize hospital services, which is wrong. that we are concerned about the crisis in seniors care. They are not. And another day, Speaker, I'd love to tell you all about universal pharmacare, but I'm out of time.
Thank you very much. Questions and comments? I recognize a member from